LabCorp, one of the big testing players amid the pandemic, with shares of the company higher by about 20% in the last year. Also one of the companies presenting at this week's JP Morgan Healthcare Conference. For more, let's bring in CNBC's Meg Terrell, who is joined by LabCorp's CEO, Adam Schechter now. Meg.
Adam, thanks for being here. I want to start by asking you about LabCorp's new contract with the CDC to help give a surveillance system really for these new variants of the coronavirus. How quickly are you going to be able to be kind of getting an eye on this and really telling us, hopefully in real-ish time, if these variants are emerging here?
Hi, Meg. It's great to see you, and it's a pleasure to be here today. So, we announced last week that we're going to be doing work for the CDC. We'll be sequencing a couple thousand samples per week. We actually submitted the first couple thousand to them this past Sunday, and then every week we'll be sequencing many patients from across the United States. We'll provide that data to the CDC. We'll give them our interpretation of it. They'll validate it and then communicate it as appropriate.
And is that essentially real-time sequencing, or is there some catch-up being done to older samples?
So right now we're doing real-time, but we also have samples from the past that we can go back if we choose to, or if we're asked to take a look at those as well.
Adam, it's Sarah Eisen. As we get these mutations and variants, are your COVID tests still as accurate? And how are you figuring that out?
Yeah, absolutely, Sarah. So every time there's a mutation, we look at our primer and our probes, and we ensure that the sensitivity of our PCR test remains the same. And so far, for every mutation that's been documented, our PCR test sensitivity remains strong. And in fact, now we're able to do 275,000 tests per day, and we still have a 1 to 2 day time to result. And we're able to do that despite the large spike that we saw over the holidays. So we've built a significant amount of capacity. The tests are very accurate. We can still find positive patients even with the mutations, and we're going to continue to build capacity.
The other question I was going to ask you was whether people who are receiving the vaccine now, and a significant number are and hope to do so soon, should they be getting blood tests from you, antibody tests from you, to make sure that it is effective and it is working and they're part of that, 95% efficacy rate that we're getting from the vaccine makers?
Yeah, so first I'll say it's been truly remarkable how fast the vaccines have come to market and how extraordinary the task has been to get them there so quickly. And I hope as many people get vaccinated as quickly as possible, as does everybody else. In terms of testing for antibodies after the vaccine, at the moment, there's no recommendation to do that. We still have to understand a lot more about the vaccines, know what to measure, how to measure. In the future, it may make sense to look at antibodies. It may make sense to look at T cells. There's still a lot more that we have to learn. So at the moment, as many people should get vaccinated as quickly as possible, and there's no recommendation to get an additional blood test afterwards.
What about after that, Adam? Are you forecasting or expecting a moment in time, maybe by next calendar year, where COVID testing will drop to zero once we've reached herd immunity?
I still think there'll be some need for PCR testing. So, for example, if the vaccine only works in 95% of patients, which, by the way, is extraordinary, 95%, but let's say 20% of people still don't take the vaccine. I think of this time next year, if somebody has a fever, doesn't feel well, they go to the physician, they may still want to check to see if they have COVID.
Adam, I'm wondering, as the new administration is set to take office next week, have you been having conversations with them? Do you have expectations for how their approach might change, support for your industry, and then maybe in the longer term, support for public health infrastructure in general to make sure we're set up so we catch the next pandemic level virus early?
No, I think that's an important question. And we've had multiple conversations with the transition team. I'm very positive in the interactions and the way they're asking good questions, they're formulating plans, and we're glad to help in any way we possibly can. And I think it's going to be a continued team effort to do everything we need to do. At the same time, I think there's a lot we can learn from this pandemic, and there's things that we need to do to, as you say, ensure that in the future, if there's another pandemic or serious issue, that we're more prepared than we were back in March of last year.
Amen to that. Adam Schechter, thanks for joining us.
Shepard Smith here. Thanks for watching CNBC on YouTube.